Welcome, everyone, and thanks for joining us for the launch of our new workshop kit, Our Best Shot, The Importance of Vaccines in Older Adults. We have a number of great speakers today who are going to share details about the workshop kit materials, tips on how best to use them, and, more details about just having an excellent educational workshop. We're going to save questions and answers until after everybody speaks, but you can submit your questions at any time as we'll be taking the questions from the Q&A section of the WebEx tool. So before we start, I want to thank our terrific partner, the National Association of Area Agencies on Aging, and the local area associations that we've worked with. They've been terrific. And I also want to thank our generous sponsors on this project, GSK, Merck, Pfizer, and Securus. I'm Sue Peshin, and I serve as President and CEO of the nonprofit Alliance for Aging Research. And for those of you who might not know us, here's a little bit about us. And we want to encourage all of you to visit our website because we have a lot of educational and policy resources on a whole variety of issues, not just on vaccines, but on things from atrial fibrillation to Alzheimer's disease to medication safety. And you can go and visit us on the web at agingresearch.org. I'm going to start by going over a few facts about vaccine-preventable diseases, as well as the human and economic burden of infectious disease in general. And all these infographics that you see come from our Silver Book series, which is at silverbook.org, and you can, download these facts and also take a look at the original source from where they come from. So despite the fact that vaccines are widely available now, many vaccine-preventable diseases are still very prevalent, in large part because of lower vaccination rates than we need to create the immunity within the society that we need to make sure that the majority of folks don't get these diseases, including a lot of vulnerable people, such as older adults and people with compromised immune systems. So you can see that in the United States, we're still experiencing about 5 to 10 million cases of pneumonia, 35 to 50 of the flu, and at least 1 million of shingles. Only about 5 to 20% of the U.S. population gets the flu each year, but that's a lot of people. And those who are most vulnerable or immunocompromised are much more likely to go into the hospital. And that leads into the diseases having pretty serious consequences, not just hospitalization, but even death. And pneumonia is the 5th most frequent cause of hospitalization in the U.S., and it's the number 6 cause of death and the number 1 cause of death from infection in the United States. So these are pretty serious. And again, the older you are, the more likely you are to be hospitalized, the more likely you are to actually die from one of these infections and or to suffer complications. So older adults are disproportionately impacted by these infectious diseases, and that's why we're here today to talk to you about this. And infectious diseases are not only threats to our health, but they're also threats to our economy. It's a pricey problem to have an infectious disease, both for individuals as well as for our healthcare system. You can see here that the direct and indirect medical costs of infectious diseases is upwards of about $120 billion a year, and that 1 in 4 physician visits are due to infectious diseases. So this is something that it takes a lot of resource, both on individuals as well as on our healthcare system. And the statistic in the lower right-hand corner always gets me, which is just getting shingles, which I'm sure a lot of you on the phone have known at least one relative or friend who has experienced shingles. They lose an average of 129 hours of work per episode. So it's a lot of lost time. And this is especially troubling since we know vaccines are very effective when people get them. And if you look at the research, when a new vaccine enters the marketplace, the disease associated with it goes down. Polio and smallpox are great examples. Since polio has been eradicated in the U.S. and since smallpox has been eradicated in the U.S. And the latter is nearly wiped out across the world. You can also look to the example of measles at Disneyland. Last summer, probably a lot of you saw in the press that about 189 people from 24 states and the District of Columbia contracted measles. And that happened in part because a lot of the folks who contracted it had not been vaccinated. It was thought that there were perhaps some people who came from another country and brought the disease into our country and then infected folks who just hadn't gotten vaccinated from it. And the reality of this is concerning because vaccine rates in seniors, for certain vaccines in particular, are quite low. You saw before that 1 in 3 seniors skips the annual flu vaccines, and we're going to be going into some of the consequences of this a little bit later. 4 in 10 aren't vaccinated for pneumonia. About half aren't immunized for tetanus, and that's something that you actually have to get boosters for every 10 years. And 76% of seniors haven't received the shingles vaccine. So last summer we released a white paper which outlined both the policy and education issues that affect whether or not seniors decide to get vaccinated. And one of the biggest findings in the study is that knowledge about vaccination is highly correlated with whether or not you vaccinate. So we met up with the National Association of Area Agencies on Aging, and we developed this campaign called Our Best Shot, also named after the white paper that we put together. And that was to promote educational programs at the local level, since we recognized that was the natural next step. So this is meant to be an on-the-ground way to influence decision-making and behavior towards vaccination for older adults, but also for their loved ones, because we see this as a really good opportunity for older adults to influence other family members to get their recommended vaccines, and also to debunk some of the myths that still float around regarding vaccines. There was actually a survey published by the American Academy of Pediatrics that found that moms and dads are refusing shots for their kids on the grounds that they're unnecessary, or they're delaying the shots that they're supposed to be given in a strict schedule. And the CDC, develops that schedule based on what the research shows in terms of what's most effective for people. So it's really important to follow the recommended schedule from the CDC. So that this could be the start of a scary story for families. So we feel like this campaign has an even bigger purpose than what we originally intended, in that older adults are often especially influential in their families, and they really could have an impact on making sure that everybody prevents these infectious diseases. So you're going to hear from my colleague in a few minutes about the campaign materials, but we're also distributing the messages of this campaign widely through social media, through a PSA campaign, and more. And we really hope that as many of you as possible will join us in spreading the word. And with that, I'm going to turn things over to Sandy Markwood, who serves as CEO of the National Association of Area Agencies on Aging. Sandy has more than 30 years of experience in the development and delivery of aging, health, human services, housing, and transportation programs in counties and cities across the nation. Prior to coming to the National Association in January of 2002, Sandy served as the Deputy Director of County Services at the National Association of Counties, where she took a lead role in research, training, conference planning, program development, technical assistance, and grants management. And it's been an absolute pleasure for us to work with N4A, and it's my pleasure to introduce Sandy, so please take it away. Thank you.
Thanks so much, Sue. I really appreciate from N4A's perspective, we are so glad to be partnering with the Alliance for Aging Research on the Our Best Shot project. This is an important effort, and it's an important partnership because it really brings together the important research that the Alliance has done through their partner network, and also from N4A's perspective allows us to take that research and translate it to the community level, the level that our members work and other community-based organizations work that touch the lives of so many people. In looking at this from the perspective of area agencies on aging, looking at and helping people educate them about the benefits of getting vaccinated and encouraging them to get vaccinated is really part of the core services of area agencies on aging. As the slide indicates, when we look across the spectrum of the service delivery systems that are part of what area agencies do every day, health and wellness is critical to that. And getting vaccinated, ensuring that you can defend yourself and protect yourself from diseases is a very core element of health and wellness. And so when we're looking at area agencies on aging and other community-based organizations really promoting and educating and getting involved in Our Best Shot, it is part of your core mission. In looking at that from the area agency perspective and our role with health promotion, it really encompasses, as I said, again, education core to this project, evidence-based programs, nutrition and care transitions. So when we're looking at promoting older adults to get vaccinated, it really is part of our health promotion mission as area agencies on aging. And again, as we move forward, area agencies are well positioned to promote vaccination awareness because you have that consumer focus, that reach into the community, in every community in the country. And also because you have been involved in advocating for system development roles and recognizing that advocating and being that bridge between the health community and what happens in a consumer's life and in their home is critical, and vaccination really is part of that bridge. But also recognizing that we're part of the nationwide infrastructure for home community-based services, which again is important for that continuum between in health care and health promotion and disease prevention. And area agencies on aging and other aging and disability CBOs have the opportunity, the capacity to reach people early on, to reach people where they live, in their homes and in their communities, and to give them the information that they need to be able to make the right choice, the best choice about health promotion and their health care, and vaccination awareness is certainly part of that. And the bottom line is a trusted resource of information and assistance, again, in every community in the country, and millions of older adults and caregivers rely on that. As, again, we look at the value of vaccinations to the health of older adults, and I know that Sue went over this, but I really think it bears repeating because of the important intersection that vaccination has to health promotion. 1 in 3 seniors skip the annual flu vaccine, resulting in at least 55,000 people hospitalized every year for flu complications. 4 in 10 seniors aren't vaccinated, with it being the 5th most common hospitalization with more than 1 million people annually, and 3 in 4 seniors don't get the shingles vaccination, resulting in 50 to 60,000 hospitalizations. So getting these vaccinations is critical to the health of older adults, but it's also important because older adults serve as mentors and role models for the rest of their family. So if older adults don't get their vaccinations, it could be that other family members won't, whether it be the adult children or their children, their grandchildren. So ensuring that older adults are vaccinated is important to the health of the older adult, but to their entire family. So with that, I will turn it over to Lindsay to tell us more about the pilot sites for the Our Best Shot campaign Thank you.
Thank you so much, Sandy. And let me just start by saying that we are so grateful to N4A and the pilot site participants who shared their valuable feedback that's allowed us to revise and perfect the workshop kit materials. They've really made them more informative, useful, and practical. All of the workshop materials are now available for free online at www.agingresearch.org/vaccines, and we encourage you to download them, print them out, and share them with your seniors. Please note that we'll be professionally printing the participant brochure that can be ordered if you are interested. I now want to take a few minutes to walk you through the available materials. After that, you'll hear from two of our pilot site leaders who will tell you more about how they use these materials and give you tips on using them more effectively. So first is the Leader's Guide, which is designed to provide all the information you or other community health leaders need to conduct an effective workshop. It has very detailed information, so it's useful for both the experienced and the first-time leader. It includes learning objectives, checklists for preparation, suggestions for promotion, a workshop agenda, detailed script, and tips on how to engage the participants and keep the workshop moving. The script is very detailed so that leaders don't need to have a background in vaccine education. However, we recommend that leaders do research in advance to make sure they're comfortable with the script and to be sure to make it their own. Next is the promotional poster, which can be printed out, filled in with upcoming workshop details, and posted in coffee shops, YMCAs, libraries, churches and synagogues, and other places where your potential audience gathers. We've also created a number of visual and supplemental resources to keep the workshop interesting and engaging. The first is our pocket film on vaccination in older adults. Our pocket films are short animated films that take confusing and often daunting medical information and make it easier to understand and visualize. This 5-minute film gives an overview of how vaccines work, why they are important, who should get them, where they can get them, and more. We released the film a month ago, and the film has been viewed close to 60,000 times and is being shared on the CDC's website and by dozens of organizations. The film is also available on YouTube, so you can link it or embed to it on your site, as well as on Vimeo, where you can download the file for use on a laptop or device that's not connected to the internet. The second resource is the PowerPoint presentation. There's a slide for each section of the agenda that offers a visual representation of the topic, key statistics, or other helpful information. The Leader's Guide notes when to play the video as well as when to advance each slide. However, we realize that not all workshop sites will have access to the technology needed to play the film or presentation. In this case, just skip the notes and script about these tools, but please direct participants to our webpage at agingresearch.org/vaccines to watch the film as a follow-up to the workshop. The third resource is a participant quiz and answer sheet. We've suggested that you pass out the quiz at the beginning of the workshop to get participants thinking about the various topics. The answer sheet can then be handed out and referred to throughout the workshop. The Leader's Guide points to the places within the conversation when participants should refer to specific questions in the quiz. Next is the Quick Guide to Vaccination in Older Adults, which is a take-home piece for participants. But we also note that it should be handed out during the workshop to facilitate the content and discussion. The Quick Guide introduces the infectious diseases that are protected against by the vaccines recommended for older adults, discussing how they're transmitted, the signs and symptoms, and the potential complications. The Quick Guide then lays out the vaccinations recommended by the CDC for adults ages 60 to 64 and 65 plus. The third piece of the Quick Guide is a vaccine tracker. We know that one of the barriers to higher vaccination rates is often a failure to keep track of needed and received vaccines. With older adults who often see multiple providers, vaccine records may be in multiple systems and aren't often consolidated in one place. This vaccine tracker can be cut out and folded to fit in a wallet so that folks can have a quick access to which vaccines they've received and when and what doses they're due for next. We also recognize the value of continued feedback on the workshop kit, so designed an evaluation form for participants. This can be useful for the workshop leaders, but we also request they are sent to us by email or mail so that we can learn from the experiences of the workshop participants. We'd also like to hear from the leaders so that have created a leader. So we've created a leader survey on SurveyMonkey. The materials just went live today at www.agingresearch.org/vaccines, and any questions can be sent my way at lclark@agingresearch.org. I now want to turn it over to our pilot site leaders. First, we'll hear from Cynthia Banks, who is the Director of Los Angeles County Community and Senior Services. Cynthia joined the Community and Senior Services in 2003 and oversees the Area Agency on Aging Adult Protective Services, Workforce Investment Act, and community-based programs. In her role as director, she's responsible for delivery of many services to the citizens of Los Angeles County, including employment and training, quality of life programs for older and disabled adults, the Human Relations Commission, and the Office of the Ombudsman. She's vice chair of the California Association of Area Agencies on Aging. Thank you, Cynthia, for helping us with the pilot program and for sharing your experiences with other community leaders today.
Incentives to those who participated. The incentives that we offered were an insulated lunch bag with a cold, hot cup, and that really held the older adults' attention because they knew if they stayed for the whole presentation that they would receive that. In addition, we found that it was almost necessary to have a public health nurse present. We have, as part of the county, a public health department, and we were able to have a public health nurse attend every one of the sessions. And so if there were questions about specific vaccines or what the effects might be of taking a particular vaccine, the public health nurse was there to assist. And so we found that very, very helpful. So I wanted to share just a bit about our successes. We had 123 individuals that went through, 135 participants that went through the programs over the 7 workshops. And many of the older adults expressed their gratitude for sharing information that they had not thought about before, and that they would share it with their friends and their relatives. And as Sandy indicated, this is really not just an older adults issue. This is a community issue because we want to make sure that the community stays healthy, especially our caregivers, family members of those who come in contact with our older adults. We also found that, as you probably all know, older adults are eager to share their experiences with vaccines, even if it was when they were younger. And so there was, in my estimation, a lot of opportunity for older adults in the settings that they were in to get to know each other a little better. So that was a good point. In addition, the quick guide that Lindsay spoke about earlier was very helpful. Our older adults found that to be very helpful. They could, again, take that with them and share that with their friends and their relatives. And then lastly, just wanted to share that the public health nurse was essential to our success in rolling out the workshops. I want to leave you with a couple of things that you might want to keep in mind when you're planning for your sessions. We found that our older adults had an attention span of about 30 to 40 minutes. And so if you could tailor your sessions to that particular time where you're sharing the most germane information during that particular time, I think you might find that more helpful. And to the extent that you can, if you have the assistance of a public health department or a nurse to assist you in translating the technical terms to familiar language that your community might be accustomed to, that would be helpful. And then to make sure that you get the largest group of individuals at a time, tie the presentations to another event, such as we did with our congregate meal sites or other events. There might be health fairs that you are having in your community. That might be a good opportunity to have an out session on this particular topic. And we know that older adults like to get incentives. This is not on the slide, but if you have the opportunity to share even a small incentive with the population that's attending the sessions, I think you will get greater participation. So, Lindsay, I'm going to turn it back over to you with that.
Thank you so much, Cynthia. We really appreciate that. We love learning from all of your participants, and I really am happy that you were able to share these points with everyone. I'm now going to turn it over to our next pilot site leader, who is Christy Sharp, Volunteer and Special Programs Manager for the Atlanta Regional Commission Area Agency on Aging. In this capacity, Christy directs ARC's RSVP and VISTA projects. She's responsible for the management and expansion of ARC's volunteer program. She works on various special programs and initiatives within the Aging Services Division. Christy has more than 15 years of experience developing, implementing, and evaluating volunteer-driven programs to build organizational, individual, and community capacity in a diverse array of settings and populations. Christy is the past president of both the Georgia Association for Volunteer Administration and Metro Atlanta COVA. Thank you so much, Christy.
Thank you, Lindsay, and thank you so much for having me. And again, I'm just so happy that we were able to participate and be a part of the Our Best Shot pilot testing, because this is really one of the key areas that we focus on as a manager of the volunteer in our health education outreach. Day to day, we are doing all kinds of outreach and education on a variety of different health topics in the community, and having materials like this are really critical to us being able to do our job. And you mentioned that one of the programs that I manage is the RSVP program, and that's really one of the ways that we have found to be an effective way to mobilize volunteers to do community outreach around health education. And we found a really rich group of volunteers and retired health professionals, educators, and social workers who are really just anxious and excited to get out and do this work and really realize the value of this work. And I think last year they did about 300 community presentations in our region on a variety of topics that helped individuals take charge of their health and access other important programs and services just to help people remain healthy and independent in the community. And as we look at Atlanta's population, we're looking at by 2030, 1 in 5 in our population will be over the age of 60. So helping them be proactive instead of reactive to maintaining and taking charge of their health is really a critical issue for us. One of the first things I just want to say again is thank you. As we look at critical issues facing the members in our community, many times we are forced to actually develop our own curriculum. And I am not necessarily a curriculum developer. Our staff, that are working on these issues are not necessarily curriculum developers. And it's outside of the scope of what we normally do. So we may spend a little bit of time here and there, and it may take a year or longer for us to develop a curriculum for an outreach program that we can actually mobilize and train volunteers on. So getting something that is so well put together that that comes to us already prepackaged, I can't tell you how excited we are to have something like this. And I guess one of the first things I want to do is maybe reiterate a little bit the value to some of those materials that Lindsay went over a little earlier, and how we have either used them so far or how we are looking at using them. And for this pilot, we only had a handful of presentations. Our senior centers and a lot of the organizations that we work with schedule 3 and 4 months out, so we're actually working now to set up more presentations in the community for the fall and the winter, because this was really a hot topic for them. When we sent out an email to our partners, there was really a whole lot of interest in them. And one of the key things when we shared information about Our Best Shot was we shared a little blurb about the program, but we also shared the pocket film that Lindsay was talking about. And the video is just a wonderful way to introduce the subject. And it not only can be used as a part of the presentation, but one of the ways that we see it is really valuable is it's something, as you mentioned, that can be loaded on a website. But we also work with a lot of different housing authorities in our region and other senior housing facilities and senior centers. And this is a great item for them to put on their closed-circuit television to promote this to their seniors. So we really see so much value in that pocket film, and as a really simple way to get the message out to older adults in the Atlanta region. We were also so happy with the comprehensiveness as well as the flexibility of the user's guide. It really makes it simple for someone who is not an expert to present this important information, and it's also put together in a way that as Cynthia mentioned, a lot of our presentations are often very short. Well, the attention span of 30 to 40 minutes, we often find when we're going out in the community to do presentations, we're lucky if we have 45 minutes to an hour to do a presentation, and sometimes it may be as short as 20 minutes for our presentation. So the information in the user's guide was presented as such, so it really made it simple for the volunteers to pull out the most relevant information based on the time and also the demographics of the audience that they were speaking to. So having those clearly defined sections and the slides and all the related activities really helped our RSVP volunteers in being successful to tailor the message to meet the needs of the group they were talking to. And also, I think the quiz was really great. It's not only interactive, but it gives the facilitator a great way to gauge the knowledge of their group already, so they're not spending as much time on things that the participants may already have a familiarity with, but they can focus more on those things where they found there were more issues or there wasn't as strong of a knowledge base there. So that was a really great tool that they were able to implement in the presentations. We also really liked the quick guide to vaccination handout and the vaccine tracker. It's always nice for a participant to have a takeaway to reinforce the key messages that we're sharing, but we also do a lot of community events and community health fairs, and we saw those two pieces especially as really nice pieces that we would be able to provide at health fairs, and people could still get really important key information without having to sit through a presentation. And we also do a lot of outreach around empowerment, and one of those things is talking a lot about personal health records. So that in our personal health record, the one we've been using now to share out in the community, doesn't have a whole lot around vaccines, and it was in tracking those vaccines, it has maybe just a couple of lines. So the vaccine tracker, I think, is a really nice piece that we'll be able to include in some of our other outreach areas to really kind of highlight the importance of keeping track of that we have not had in the past. So we really, really liked that. And I will mention a little bit about the PowerPoint. I think Lindsay already mentioned that, sometimes the facilities are not conducive to using a PowerPoint, and we found that in some of the presentations that we did, but I think it was also nice to have it, but I think the nice thing about this one is the presentation is developed in such a way that it's not dependent on it, and the feedback that we got from our presenters was that there was no, they didn't miss it if they didn't have it, but it was a nice tool to have if the site had the capacity to offer it. But also, I think what we found in the past is sometimes the PowerPoint can be distracting for older adults if they're not used to that kind of format. So that's something as you're going out in the community, you might want to talk a little bit more with whoever is coordinating that site or whoever is helping to set up the event for you, just to learn more about your participants to make sure that wouldn't be more of a distraction than a supportive piece for them. And I also want to say how valuable and how happy I am to see that you've got an evaluation component to this. We've already found it to be helpful for us in the presentations that we have done. It tells us how we're doing. It lets us know how the participants are doing, and it really helps us to see some of the things that we might be missing and get important feedback. As a manager of a volunteer program, we're not always able to be out there with our volunteers all the time, but this helps give us a good gauge on what they're doing, how they're doing, and how they're sharing the information. So I think that's wonderful. And I love the fact that the facilitator evaluation is online. That makes it easy to get the feedback quickly and directly. So I really like that was done through a SurveyMonkey. I mentioned we did several presentations, and in order to set those up, we actually reached out to our partners. Because we do so many community presentations, we have a large network that we keep in touch on a regular basis through newsletters, emails about what we have going on, what new kind of presentations and activities we have available. And some of our best community partners who support us are our senior centers. We have around 50 in the Atlanta region. Also, the local parks and recreation facilities have a lot of seniors who participate in their programs. We work very closely with the senior high-rises as well as a lot of faith-based organizations. And we also work closely with the YMCAs in our area. So these were the people that we reached out initially to share Our Best Shot information with. And as I said, we received a lot of information and are already starting to work to schedule additional presentations out in the community, especially since flu season is upon us. We didn't necessarily, our sites usually do most of the promotion, but I have to say the flyer as well, that you have the flyer/poster, was really beneficial because they do ask us for materials to help promote the events, either in their facility or out in the community to bring community participants in. And so having that one, consistent, recognizable piece to promote these presentations in the community is really valuable, and it gives a nice uniform look to the presentation, which I think is really beneficial. From the different volunteers that we had conduct the sessions, it was really nice to see the positive feedback that we got, not only from the volunteers, the site coordinators at these locations had a lot of wonderful things to say, and we also had a lot of good feedback from the participants. Even with the diverse group of participants we had going through the sessions, it was really interesting to see that there were 3 key things that they were all taking away and that we saw consistently in the feedback and the evaluations is they all had a better understanding of the different vaccinations. They understood the importance of getting vaccinated, and they also understood the need to track and remain current on vaccinations. And, I think those are some of the 3 key things we wanted, so it was really wonderful to see them coming away with those as takeaways after the presentation. I do want to just touch briefly on moving forward, where we see opportunity for Our Best Shots programs. As I mentioned, we reach about 50,000 individuals a year with our community education, and there's no way we'd be able to do that with staff only. We rely on our about 300 different volunteers who go out in the community to help us with this. And so the way that we see this working is we can really leverage our reach through Train the Trainer sessions and using these materials to train our volunteers to go out and do the community sessions and add Our Best Shot to our ongoing list of our Speakers Bureau opportunities that we can provide out in the community. And not only training our volunteers, but we also see a really wonderful opportunity to work with the senior center managers and also a lot of the residence coordinators that we work with. These groups meet regularly in our region, and we're looking forward to bringing these materials to them and sharing these materials with them so we can empower them to share these messages with their residents and really get the message out. And the other way we see this as being a really great opportunity is to partner with some of our local pharmacies. We are looking at the fall to do some special events where we can provide Our Best Shot educational session, but also work with some of the local pharmacy to actually bring the flu and other vaccinations on site at the time of the event. We've done these types of events in the past with a lot of success, and it's just such a win-win for the participants, especially those that may have transportation issues. So we are going to be working on trying to set up some of these events in the fall and winter to not only provide the education, but also link them to the services. So I think that is all I have.
Great. I thought that was tremendous. Good job to all of you. Cynthia and Christy in particular, I actually have a question that was submitted as follow-up. You guys were really, really thorough, but a question did come in about whether or not the folks that attended the pilots had any actual concerns about vaccines, and if they did, what were the concerns?
Well, I'll speak first. Yes, there were some concerns. There were comments about especially the flu vaccine. I believe we had one participant who had gotten the flu shot and then had the flu. that was particularly important at that point to make sure that we had the public health nurse there to explain that that does sometimes happen with the flu vaccine, but if in fact you get the flu after taking the vaccine, it's usually a weaker case than it would have been had you not gotten the vaccine. So that, yes, that question did come up.
And actually, Cynthia, we had the same issue come up in our presentations. That was one of the key concerns.
Yes.
Okay, that makes sense. I got another question for the two of you about the strengths of the kit. I think actually both of you touched on a lot of this, but maybe just sort of reiterating. You had said, folks only have so much attention span, so, kind of tighten it up a little bit. But are there any other things that really seem to resonate? Was the video a hit? Was, anything in particular that you would just emphasize for people?
Well, I think our folks really liked the video. And I think also just going through the different types of vaccines there were. I think not all of our participants knew that there were vaccines for all of the different types of infections. So I think that was, I think that should be emphasized because not everyone knows that there's a vaccine for all of the infections out there. Christy?
And no, I think in our reach we found the same. They really liked learning about all the different vaccinations, and having that tangible tracker to take with them, I think, was really nice. They like showing what they know too. So the quiz was fun because people, like to provide a lot of input, and you hear a lot of personal stories, which is something you sometimes have to manage. But it's great for the participants to hear.
Okay. All right, that's great. These are great answers. This next one I'm happy to take, and then maybe also offer, it to Sandy if you have anything to add. But somebody is sort of making the point, I guess, on the slide that I had with the vaccines sort of facing each other, the shots facing each other, about what does effectiveness mean with the vaccines. And I think there's probably a bit of a underlying question here around effectiveness, because it is true. I think a couple of us have pointed out on this webcast that for some of these vaccines, it's a little bit different, I think, with adult infections as opposed to childhood. With childhood vaccines, you really are just trying to prevent something from happening at all. So it's complete prevention. But with adults, a lot of times you still can get whatever the infection might be, but you get it to a lesser extent. Now, the flu vaccine can be tricky because there have been years when the flu vaccine actually hasn't been effective and they haven't hit the mark. But that's rare. And, more often than not, it does hit the mark. It does tackle the flu strains that are going out in any particular year. But it doesn't mean that you are, 100% guaranteed not to necessarily get the flu. You may get it, but you'll get it in a much milder form. And that seems like sort of a consolation prize, but it's particularly impactful for older adults because they are the ones that are much more likely to end up in the hospital, or, God forbid, dying from the infection. So it really can be impactful for them, even if they do end up getting the infection. So that's what we mean when we talk about effectiveness. And it is really, really important. I want to emphasize that when your doctor or healthcare provider recommends that you get it in the schedule and time that they recommend it. That's really critical for both adults and for children. There's a rationale behind the recommendations from the CDC. So when they tell you you need a booster every 10 years for tetanus, for example, you should get it because it does, the effectiveness does wear off. And at 11 or 12 years is not as good as doing it at the time that they recommend it. So that's what we mean about effectiveness. We also have another question that came in. I'm sorry, Sandy, did you want to add anything to that?
No, I think, Sue, you did a great job. I think, the issue of effectiveness, we can't assure that everything is 100% effective. However, how many of us take a multivitamin every day hoping that that's going to make us healthy? Because it's something that we can do to help support our overall health. That doesn't mean we won't get sick, but the likelihood is that we will be healthier because we do that. And I think when you look at vaccines, it is a choice that you can make to help protect your health. It may not mean that you won't get an illness, but as Sue said, studies have shown that you will get less of an illness or it won't be as severe. So I think that, Sue, I think you did a great job in responding to the question.
Thank you, Sandy. We have another question about the program materials. Is the program only for pneumonia, shingles, and flu, or does it also cover other immunizations like whooping cough, et cetera? And it's a great question. It covers all of the vaccines that are recommended for adults 60 to 64 and 65 plus. That does include boosters for whooping cough and other vaccines that older adults may have received when they were younger. It also covers, it doesn't get into those vaccinations that are recommended for people who are at higher risk because of either their lifestyle, travel, or occupation, but it does reference that. So it does cover every vaccine that's recommended for older adults to receive. And then we also have another question about whether or not we recruit leaders to help share the message, to include their personal stories. We would be thrilled to include personal stories and to get feedback and to work with partners. So anyone who's interested in informally or formally helping us spread the word and use these materials, please feel free to email me. Again, my email is lclark with an E at the end at agingresearch.org. And so we are welcoming anyone who wants to partner with us in helping get the word out and use these materials. I think that is it for the questions. So I just want to thank everyone for participating. Sue, I don't know.
Sure, yeah. I just want to thank again Sandy, Cynthia, Christy, and 4A in general. You guys have been absolutely amazing, and we're thrilled with the pilot work and think that it really enhanced the materials. And we just really want to encourage everybody who's tuning in, please just use this kit. It's a soup to nuts kit, has everything you need. Contact us if you have any questions. Please help us also spread the word. And have a great rest of your day. Thanks so much for joining us.